There are fears that this could be Ukraine's toughest winter since the war began, given the fragile state of its energy network. Dr. Hans Kluge is Director for Europe at the World Health Organization.
The big concern, Jamie, from the authorities, the government, the doctors, the nurses I spoke to close to the front line, are the relentless attacks on the energy infrastructure and the healthcare facilities, which will mean that the third winter of the war in Ukraine may well be the worst one, because 40% of the facilities have no backup plan for any heating or electricity, which of course means that hospitals cannot function. So this is the very big concern. The country needs heating units, the country needs generators in order to continue blood transfusions, in order to continue vaccinations, and just for patients not to freeze.
That's a very bleak picture indeed. I wonder how you would assess the amount of international assistance that Ukraine is getting in terms of humanitarian assistance.
The United Nations pulled a joint humanitarian appeal together, and unfortunately, only 40% of the needs are being covered. 40% of the population in 2024 is in need of humanitarian assistance. So there should be no fatigue to support Ukraine in these difficult times, because as long as the war is continuing, the humanitarian, the medical needs are only going to increase.
Television channels around the world, including this one, are obviously reporting today the Middle East, as we do every day. I wonder if you think that Ukraine is almost becoming the world's forgotten war, and the people in Ukraine forgotten.
Well, that's a point, Jamie. Of course, we say that every suffering is too much for human beings, but definitely there is a fatigue, and what you have is that donors financing emergencies are decreasing, but at the other hand, there is no development support, because countries are telling, if we build a hospital and it's going to be bombed, then maybe better to wait a little bit. And this plays also on the mental health, not at least the mental health and the fatigue of the healthcare workers. So mental health, rehabilitation, prosthesis, because more than 20,000 people have lost an arm or a leg, it is absolutely necessary that we continue to stand in global solidarity with Ukraine.
We're in the middle of September. Winter's coming. What does that mean for Ukraine?
What it means is that they have to prepare for heating, proper water, electricity, make sure the generators are in order, and to further advocate for a very, very strong support. Having said that, when I talk to the children close to the front line and I ask them what they wish for, there's only one thing they wish for, Jamie. It's for peace. The most important medicine we desperately need is peace.